director and director of the Eva Clinic in Athens, Greece, Dr. Stavros Tombris. We've been having technical difficulty. Now we have somebody outside honking their horn difficulty. Okay, it's saying we are live and from the VBF page. So now I need all of our peeps from the VBF page to let us know that you see us. I'm on the VBF page. Okay, this is the old one saying it was soon. Three people are on. Oh, you're seeing us. Thank you. Thank you, Natalie. Okay, I'm just waiting to see on my phone. This is going live soon. It's okay. The questions will start popping up on here. So, all right, we are live, and just let us know. I know Natalie's seeing us, so Corinne and Ava, and it shows 11. We need you to like type a message so we can see it, because I'm not seeing any statements or any questions or any messages. I see me saying I'm going live soon. Okay, so again, this is like comedy of errors. All right, Corinne, somebody post that it shows 9 people are on, but we're not seeing. Natalie, can you type a message? Just say hi so we can see some messages coming in. Maybe the messages will be popping up on my phone. I do not know why all this is happening, but if I have to, I'll go live on my iPhone soon. I'm not seeing any messages, Kristen. Kristen's saying she's seeing them. I'm not seeing them on my phone. Let me try and see if I even see them on my phone, then I can answer. So, why I'm sorting this out, we have Dr. Tombris will be with us in New York City at our conference. I'm not seeing them.
We do have messages though.
Okay, can I use
this?
And
there's a major lag.
Oh, well, all right. Can I use your phone?
Sure.
All right, well, we're not seeing these questions, but okay, they're not popping up on my screen. Again, there's been a shift and a change in Facebook Live, so I'm glad you can see us. I'm using Natalie's phone, so Kristen's saying we're on, but I'm not seeing it on my phone or on here. Stephanie, hi. We have a 14-month-old who has a VM on her eyelid. We did an ultrasound and MRI to confirm its surface level. The doctors recommended doing YAG while she is awake. Okay. Is that the best course of treatment? Should we treat or should we wait?
Well, there's something has to be done. Something needs to be done. But on a VM, on an awake
baby on the eyelid,
it's going to be too hard.
Yeah.
Because the baby has to stand still. And it's very dangerous to do laser around
14-month-old.
Yeah, around the eye without having the baby standing still, unless they use one of these body splints. But again, still the eye may open. So no, I would say no, unless the baby goes to bed. Now, as regarding the feasibility of treating this with a laser, it has to do with the depth of the lesion. So if it's too superficial, then yes, the YAG may work, but usually the VM's a little deeper. So if we're dealing with a deep lesion which is not allowing full opening of the eye, then maybe we should consider maybe a surgical intervention as well. To be able to fully evaluate this case, definitely the doctor needs to see an MRI, something that will tell us where exactly the venous malformation is located.
Well, the other thing is what we take for granted when someone says it's been diagnosed that it's a VM. Yeah. We don't know. It could be a hemangioma.
It can be hemangioma.
So we don't know where you are. Oh, sorry, Natalie. Can you get this back? I was just reading the questions so nicely, and I touched something and they disappeared. Oh wait, 13 comments. Here we go. Okay, so wait, is that it?
It's from Katerina.
Katerina, is that the one? No. It was Stephanie. Wait, okay, right.
Yeah.
But we were answering Stephanie. So Stephanie, we don't know where you're from, but you can email Dr. Tombris through the VBF website at birthmark.org, because you would really to see the picture first to
Well,
make sure.
they say it's a surface level.
And surface, so superficial.
Yeah, and the
Maybe it's a port wine.
we need to see at least the clinical picture, clinical photo, and the MRI.
Right. So again, it's very hard. We can't see any images. You don't do this stuff during the Facebook Live. It's mostly questions.
Questions, general principles of what we do.
Yeah, exactly. So Katerina is saying many greetings to Dr. Linda and the amazing Dr. Tombris,
Thank you.
Dr. Gokas and his team, Aphrodite and Natalie, shout out from Dunja, Serbia. Dr. Tombris is an incredibly humane man, an excellent physician. He brings us back our faith in the future. We know that dealing with complex AVMs is very difficult, but when you trust the doctor, it's half the healing. We hope that the next steps will be successful as the first in November. See you soon in Athens. And that's very important. We can't get that message out enough about getting an accurate diagnosis from an appropriate physician that knows the latest in diagnostic and treatment protocols. So that's why we exist.
Especially when you're dealing with a very complicated case like Dunya's case.
Yeah.
It is even harder to try to convince the patients that the protocol needs to be done in a certain sequence of events, because in this case we have at least two distinct niduses of AVM plus another floor of the mouth lesion which is not an AVM. So we have to treat accordingly. We have to deal with the AVMs first and then treat the floor of the mouth. It's not, it's not easy to convince all people that it may take a little while for this all procedures to be completed, but these are the necessary steps. So I think both Dunya and Katerina, and I thank them very much for the comments, have both realized that this is the right sequence of events that we need to follow. And now, since November that we've done the first stage of their treatment, I think they're happy with the results and they're eager to continue with the next phases. And I'm very glad that they do.
And remember, we exist as a conduit between the physician and the patient. We can help you to get an accurate diagnosis and an appropriate treatment plan. That's why we exist, to make these connections like she made with you. Mentor from Albania says hi. Kristen's saying there's 10 on, we see 28, but again, I don't know, like everything's been wonky. We're gonna have to get this all sorted out. Hi Kim, hi Jennifer, and then Kristen's posting Dr. Tombris's email for people for how to get to him. So I'm just thankful. So there is a lag. No lag here. You look great. Kristen's saying everything's coming through. We did switch off of my personal page, and I think some people just haven't seen it yet. Okay, so we see 27, and I'm using another. Kristen, I don't know if you're. Oh yeah, 28. So I'm not seeing any questions under Kristen, so we can take questions now. Again, our conference is on Saturday, September 26th in New York City at the Lenox Hill Hospital, and Dr. Tombris, one of the world's leading maxillofacial surgeons for vascular anomalies, will be there doing free consultations and doing a lecture. So if you haven't registered for our conference, please do so. And by the way, Kristen will tell you, our business operations manager, we're like off the chart with registrations. It's February and we are like just blowing it out of the water. So those free hotel rooms are going really, really quick. So if you want to see Dr. Tombris or Dr. Wayner or Dr. Nelson or Dr. Geronimus, please sign up early. We have free laser. We're doing free dental checkups, psychotherapy sessions, insurance sessions, great talks. You want to come. We are committed to you getting an accurate diagnosis and an appropriate treatment plan. Okay, so I'm still not seeing maybe Mentor or Aaron or Kim. If you have a question, let it come through. I'm not seeing any. I don't know if you're seeing any more questions, Kristen. Like I said, little technical difficulty for now, but Okay, 28 is right. There's no lag. I see the messages in the feed. Okay. So, I guess some of the most exciting things that are going on is we're working now with Dr. Buddy Cohen at Johns Hopkins on a new topical for pain that's supposed to be like 2 or 3 times as effective at numbing as Emla cream. So we're going to be starting that study pretty soon. Kristen's saying lots of questions, scroll down, but I'm not seeing them. Natalie, are you seeing them?
I'm not logged in.
Oh, okay. Well, I'm just saying, I'm not seeing anything after you, Kristen, that says contact Dr. Tombris and the Eva Clinic. So let me try. I'm just, none of the questions are showing up on my laptop. So I've got 2 cell phones here trying to get to where all the questions are. And nothing's popping up on my phone. This is just saying going live. I'm not even getting the live feed on my phone, so I don't know. Natalie, can you see?
Natalie, can you bring my phone?
Yeah, I mean, Kristen's saying there's a lot of questions, but let's see, let me try this. New comments. Please pop up, please pop up, please pop up. It's saying there's new comments, but I'm not seeing them. Okay, yeah, we're not seeing any new questions. I just posted on here, it's showing 28 people. Like I said, I'm on that one's 7 comments. This is an old one. This isn't what's going on right now, is it? No. Okay, yeah, I think these are the ones from before. Are you seeing the questions?
The latest one that I did see is Etoile Sablé. Did you see that?
No.
Let's use this one.
Yeah, I don't know. See, this is frozen. Okay. All right. So, yeah, we saw Mentor. My son, after 10 laser, his birthmark is coming after 2 years stop. So I guess he's talking about we are on the VBF page. I am on the VBF page, Kristen, on my phone.
Hi, everybody.
Oops,
Dr. Linda,
sorry.
live from Athens.
But that's the old one. So yeah, Kristen, it's something's wonky because I am on the VBF page. But so here, Etiole Sablé. So he's saying his son has 10. And now after 2 years, it's coming back. We hear about this a lot. No 2 port wine stains have a recurrence rate that's the same. Some can come back, right? After...
What type of?
It's a port wine stain because he's getting... I guess he's like, why is it coming back? After 2 years, we had all these treatments, but these are...
Yeah, but we don't see quite often a complete response, so meaning that the lesion will fade away completely. So whatever is left after the lesion had faded, it can always get dark again, be dark again. So in this case, you need to, if you already had a good response, you need to continue with the treatment, and maybe the settings can be a little bit different.
Yeah.
Go a little deeper.
Yeah, I mean, check what the settings were that were used. The new Prima laser is out. They may want to try that. Again, we will be using the Prima laser at our conference. Again, Kristen, I'm not able on my phone on the VBF page to see it, but we have Dr. Tombris' phone, so we're seeing. So Raphael saying, have you seen the reaction of having erysipelas on the hemangioma? It's a new word for me.
Well, this is a type of skin infection and
ulceration, maybe?
No, it's not ulceration. It's redness. It can happen if there was any type of discontinuation of the skin surface, either because of ulceration or because of laser treatment that created a problem superficially. Then yes, you can get infection there, and you can treat it accordingly. The pediatrician will guide you, or the dermatologist, what to do exactly.
So that's just normal wound care or treatment for what would be. Okay. So Adissa from Sarajevo says hi. Hi, hello. Shayna is saying her 10-month-old was born with a tufted angioma, Kaposiform hemangioma endothelioma, KHE. And by the way, they're a little different, the tufted and the KHE and the Kazakh-Mirror.
It's according to the depth of, like the tufted angioma, it's a little more superficial. The KHE is a little deeper.
Yeah, and they've been using sirolimus, which is, typical. Have you ever seen this angioma? We're being treated at Penn State. And I think I've actually communicated with Shayna. I'm not sure. I think we have.
Well, let me tell you. You can try medications, and you have to. The doctors have to distinguish if they're dealing with the tufted angioma or a KHE, because the KHE has a great chance of causing some problems, like the entrapment of platelets and concern of the coagulation factors, systemic problems. So if the lesion is surgically manageable, then surgery may also be an option. It depends on the site, the location, and the size of the lesion. If not, then of course treatment with other treatment modalities can be utilized, like sirolimus, for example. So if you want, you can just send me a photo for me, and I can guide you a little better in what is the best treatment option for your child.
All right, so Kristen's been sending me messages that aren't popping up on any of the phones. Again, Facebook world has changed the Facebook Live system. We spent almost an hour trying to download their new streaming management system, and it's not linking with the questions part, so I'm going to get this all straightened out before the next one, but which will be in Miami with Dr. Duarte. So Mentor said, how many treatments for hemangioma? I was in Athens and make your first treatment. He has a port wine, and he had treatment there. And, I guess you just keep getting the treatments until you get the maximum result.
It's according to the response that you see, and it's according to where you want to stop. Like every time you treat, and if you continue to see improvement, you should do the next one. If you stop seeing improvement, then you may say, okay, this is as far as it can go. But this may not be always true, because sometimes the variability of the settings and it's the time of the year that you're doing it. It's the response that was achieved from the previous one, the level, how superficial or deep, the age of the patient. There are many variables. But if you do a couple of treatments and you don't see any improvement, then you have either to insist by discussing with your doctor with different changes or even different lasers. Or you can say, okay, this is what we can achieve, and just stop it until you see it darkening, so you can go back.
So Amy wants to know, Champ, about someone to treat her port wine in the Belgium area. And we know about Peter Berlin in Berlin. That's his name. I'm not sure. I mean, there's Dr. Boone is in that area.
Yes.
Yeah, but
they should contact Dr. Lawrence Boone, a plastic surgeon.
Yeah, and she's on our website.
She's an expert in vascular anomalies, and she's a surgeon. But even if she's not doing lasers herself, she can guide you, or she does the lasers herself. She will be able to treat you.
Yeah, and yes, the gold standard laser is still the VB pulse dye, and the beam is out now. As Dr. Nelson said last month or 2 months ago, they're recalibrating. They're showing some little blips, but it's those who are getting a good result are getting a good result. And by the way, I had it tested on me, and I did get a little burn on. So, okay, I'm getting some messages. How is it going here? Emma is saying, thank you for all the help and advice you give. This is Emma Hill, especially on the hemangioma parent group. It's full of parents like me that are clueless, and you always step in and offer those for extreme. Thank you. You're welcome. And then Kim Let me see. Okay, I'm seeing some of these out of sequence because Kristen's being awesome and sending them to me. Kim Crow, my daughter has a hemangioma above her heart. She's in. Now, I'm not sure if it involves the breast bud, but that's an issue. The doctor said this may need to be removed when she starts puberty because of the breast tissue. Do you see this? I mean, I know Milton treats these ASAP so they don't affect the breast bud tissue.
I think it won't affect it. I think this is a hemangioma which is on a certain layer within the dermis, so if it's removed in the proper way, it won't affect the breast.
Again, like if you want to send a picture too, okay, Kristen and the ones you sent me, Amy, Emma, Kim again, Audra, Lynn, drug inhibitors can be identified as new treatment management of some lymphatic malformations. My son has venous, I don't know if this is the edema. Oh yeah, here it is. It's cut off a little. My son has venous lymphatic malformation and ulceration very often. What are the best creams to treat the wound?
Where is the wound located? Skin?
Yeah, I just says my son has venous lymphatic malformation and ulcerations are off. So again, when you guys are asking your questions, remember we can't see any images. So you have to give us descriptive and say my son has what's been diagnosed as lymphatic malformation on the thigh and it appears to be ulcerating. What's the best treatment? Again, though, you can send pictures to Dr. Tombris after this and he'll be very happy to answer your question.
Every time we had a Facebook Live and people sent questions and photos to us, they were all answered. So if you want, you can send a photo and you will immediately get your answer.
And even like the one that you're saying is of the heart, it's like how close is that to the breast tissue? Maybe it's here, and not even near it. Audrey Colin, the drug inhibitor. She's listed, can be identified as new treatment. I mean, I know they're working on some new drugs for lymphatic malformation. Stephanie Pinzoza said her 8-week-old is on propranolol for 2 hemangiomas. Is there something else I should be doing? Let's try this. Oh yeah, I haven't seen Tia's yet. Wow, these are all coming. We haven't seen any of these.
Okay.
Yeah.
From the beginning.
Okay, and that's that one. And so now Shri Bushi, he's educated about port wine in other countries. We are working on that. That's one of our missions. Diana Chavez, lip hemangioma. What can you do for ulceration aside from propranolol? Why do they appear?
You can excise it if it's manageable. I've excised lip hemangiomas, which I thought the propranolol wouldn't be the end of the story. That I didn't expect that the medication will solve the problem completely. So if I had problems, despite being on propranolol, I would have tried surgical adhesion.
And I mean, we're getting a lot of reports on lip, nasal tip, and orbit ones being persistent. Yeah. They try to wean off, and they just keep rebounding, and the surgery is the only option.
If you have the lesion 2 centimeters thick, or 1
like
thick,
this thick.
And even if there is a response to propranolol, this will shrink the lesion, but this is not. It doesn't mean that the lesion disappears. An ulcerated lesion means that the lesion is active and expanded, so there is no response to it.
Yeah.
But now we need to know for how long have you been on propranolol,
right.
If there should have been a response by now.
Yeah, the more details it helps. But again, we can send these to. So Claudia Snooki sent us 2 questions or 2 statements. I don't really know what her question is. As I keep going here, maybe I'll see it or Kristen will send it. but she's like, my daughter is 3 and she has a Navy malformation. We don't know where it is. I'm not, and nobody in Germany knows anything. Well, you have that clinic in Berlin, and if she emails you, you can see her in Berlin.
We can
and
see
put
you
her
in Berlin.
in touch.
The clinic's in Eberswalde, and it's called the Centrum for Vascular Malformationen. You will easily find it on the internet. You can either contact me and go through me, or you can just directly contact them. It's a clinic dedicated to vascular anomalies, very close where you live.
Okay. Well, a bunch of big glitches. People are popping up saying we're cutting in and out. So, and then we're not seeing any messages. We're on 5 phones. It can only be the coronavirus that has affected the laptop. It's got to be the coronavirus. No, I haven't been in China, but you have. But last year. So Kia is saying her 12-month-old has a lip hemangioma. She's been on hemangiol for 2 months, which is good. It's not grown, but our derm wants to taper. Is laser an option, or do we wait this out for H2A?
Since 2 months, you can treat for a longer period of time. It can be up to 6 months. Some people do it even for a long period of time. How is it?
2 months, which is still proliferative phase.
No,
Oh, she's been on it. Oh, 12 months. 12 months.
12 months.
Yeah.
So probably because it's the end of the proliferation phase, that's why the pediatrician wants to stop the medication. Well, we have seen that some of hemangiomas may even grow further than the 12-month period. So I would insist on keeping the child on medication for more. And if there are remaining signs of the hemangioma, then we may correct the surgery.
Much apologies for the technical difficulties. I'm sorry here, I'll just put it on him. We're back. I don't know if you can hear us better. We can say.
Infection that this baby had.
Right, that skin infection.
Okay, this strep infection, and this is. I don't know if you are under medical care, but if you're watching still, you have to be seen, okay, and be treated for that with the proper antibiotics. So it's not, but if you have the name of the condition, so probably somebody gave you the diagnosis, so I hope you're under medical care and attention.
Okay, so we have a test comment from Natalie. Juliet is back on. She's saying, are there any cures for cutis marmorata? It's a good question. Dr. Geronimus and Dr. Nelson both answered that last month, that the laser has been effective.
Yeah.
I don't know if you want to comment.
I do agree with both of them, and I would say as long as we're dealing with cutis marmorata.
Right.
Okay.
And that's been accurately diagnosed.
Exactly.
And by the way, most of them do fade out, at least a percentage.
They
so some doctors, like Dr. Geronimus and Dr. Nelson, will laser early, or they can say wait and to see what kind of clearance you get, then laser.
Mm-hmm.
Would you agree with that?
I agree. Yeah.
Okay. So, all right. So we're seeing a couple more questions, and we can try to make up for some, stay on a little longer and make up for some of those questions that you couldn't hear us or they didn't get answered. Dr. Geronimo or Dr. Tombris was just restating about ulcers that need to get taken care of. Aniko, hi. It was nice meeting you in Athens. I talked briefly to Dr. Tombris about my daughter's possible treatment with him under GA, but his staff informed me they are, yes, you're getting the laser. When do you think it'll be up and running? And
well, in a month. Now we're doing the technical inspection of it, and we're going to have it soon.
And I'm very excited to announce I will be working on details for a free laser clinic in Europe, right here at the EVA clinic with Dr. Tombris, and we're going to be inviting, I'm not sure which one will come, but we're inviting Dr. Geronimus and Dr. Nelson to come. We just have to sort out the details, but we're looking at this before the fall.
Yep.
So just stay tuned and watch to see. We also have a free laser clinic that's going to be coming up in January in Texas. So we're very excited about getting these free laser clinics. Heather's saying she's getting conflicting information, whether they should continue with the sclerotherapy. Oh, for our daughter's VM on her lip, or if we should do the debulking again because she didn't hear you. You want to talk about how that's? Like
If I want to repeat again, the sclerotherapy can be either as a preparation for surgery or a treatment modality on its own. The decision is based on how thick the lesion is and where exactly it is located. If we're talking about, let's say, the corner of the mouth, the upper lip, the lower lip, we can prepare the lesion with sclerotherapy, and then we can excise, and it has a very, very good aesthetic result. If I had a photo, I would have been able to comment specifically on your case. But if I have to think all the possibilities and where is the location of the lesion, how thick it is, and what kind of problems it causes, then I need to generalize and summarize all possibilities. So it's not a very specific answer.
Right. And she brings up the question of a recurring VM if you do debulk it.
If it's something which is localized and you do sclerotherapy and surgical excision, you will never see it coming back.
Good.
Ever.
So that's why it's important to have the right surgeon.
Ever. We have cases of 10 years follow-up, 12 years follow-up. They never came back.
Perfect. Corinne's on. Hi, Corinne. Sorry again, major technical difficulties. We had a little bit last month, but it's this whole new Facebook platform switch over from the interface that we use to go live with the camera and the software. So we have another one, Juniette. That's the one who said my son's cutis marmorata comes on very purple when he's cold and disappears when he's warm. That's very common.
It's typical.
Yeah, that's typical. Yep, thank you. I don't know why we're not seeing all the questions. They all just disappeared on my phone. So happily we can see your phone with the questions because now we can't see any. It's not showing up. The questions aren't even showing up on my...
Right now, there's no live.
Oh, there's no questions or there's no
live right now.
Oh, there's no live?
Okay, you're back.
Okay. So again, sorry, major difficulties. We are a little over for those of you who didn't get your questions asked. Sergio saying my daughter is 1.5 years old and has a hemangioma on her face. Can we use timolol for the eyes?
If it's a small and superficial lesion, yes, you can try with it. But again, it depends how old is the kid. How old is it?
He's saying 1.5.
1.5 years old.
Yeah.
It's not in the proliferative phase. So you can try for the beginning, but you have to tell us what is the extent of the lesion, and we don't want you to do things without expecting any result.
Tara's saying, what causes the temp color change? I've always wondered that with the cutis marmorata, why does the heat make them disappear? Which is actually so interesting because it's the opposite of a port wine. Yeah, it's that whole innervation, correct? An innervative process. So it's basically
there's an answer about the lip, I think. How extended the lip is.
Okay, but Tara was still saying about the color changes. She's wondered. I still hear and see, but I don't know. Maybe we're still lagging. We're just going to have to. Can we use timolol for the eyes?
We said that.
Right. It covers most of her lip and goes on the inside to her gum. That's the venous malformation.
Okay.
Are you hearing us okay, Natalie?
It's much clearer.
Okay.
If it covers most of the lip, then sclerotherapy, and then if whatever remains as an aesthetic issue, thickness, length, the general appearance of the lip, then you can correct it with a surgical debulking.
Okay, well, we're still answering some questions because we've had so many technical difficulties. There are too many to list, but and we're even still having problems seeing questions. And We have like 5 phones now going and 2 laptops. Okay, and Corinne's saying she can hear, but just from phones, maybe not laptops. Tara is saying, yeah, it gets we talked about that on that port wine. Katerina's saying she's watching, and Tara is saying it sounds good, Linda, from your phones. So, well, I guess until all of this, we had the problem last month with Dr. Wayner, but we got through it using my iPhone. So it might have to be the iPhone from now on, and I guess thank God for it, but it's a little hard to hold the phone through a whole hour.
It was the same problem.
No, it's not, because we just couldn't even, the hospital where Dr. Wayner was wouldn't allow us to connect. It was a block. It was a block on this. But now, like Natalie found, there's a new platform for the Facebook Live. They're not letting you use the old system unless you say, oh, wait, I'm having a bad experience, and that's what I did. I said, I'm not getting through. I need to go back to the old way. So Sherry's saying you're clear and live in Australia. Hello. Dylan's saying I can hear from my computer. So Dylan can hear from his computer. We're going to give it a couple more minutes for those of you that did not hear your answer to your questions from Dr. Tombris, or it was broken up and you got frustrated like we are. Please ask your question again. Again, he will be at the VBF conference on September 25th and 26th. He'll be there because Friday is Free Laser Day. He'll be with Dr. Geronimus. Saturday's the conference. And then we are working on scheduling a free laser clinic in Europe, which will be here at the EVA Clinic in Athens sometime this year. We're going to work on that when we can get Dr. Geronimus and Dr. Nelson here with Dr. Tombris. So stay tuned, and that'll be a free laser clinic. So let me see. They're just saying they can hear us now. We're clear and live. I'm going to see if I can go back and see one that maybe they may not have heard about us or heard us. Again, like that one with the lesion over the chest that I was a little concerned about. If that's a malformation, like you said, maybe a niche or a riche, they really need to get it tested, right?
Or a vascular.
Yeah, and send a picture with some imaging studies. All right. Well, I think what we're going to do is we're just going to call it a day. We've really, I think we've done the best we could.
Well,
given the circumstances.
We've tried, and this is for the sake of the people that are interested in vascular lesions. They have a patient in their family environment, or their patients themselves. Technical problems is always a possibility.
Yeah.
Sometimes even in the operating room. And
True.
We always try to be prepared, mostly in the operating room, not to run into any problems. Even in the Facebook Lives.
I'm not even seeing any of this.
I think you can play the video again and see the questions and answers we discussed. And if something is not clarified due to the technical problems, I will be very, very happy to answer the same questions through an email.
And the one mom that missed your answer, she was the one that had the daughter with the port wine stain on the gum. Mm-hmm. And she didn't get what you were saying. She's saying it's starting to get the hyperplasia.
Yeah.
So how would you address
there
that?
It's very, the patient is very young. We cannot
4
do
months,
anything right now. We have to, watch at this stage. And usually we perform surgical recontouring of the hypertrophied tissues, even if we're talking about the soft tissues or the bones at a later stage.
Okay. Well, I'd like to thank Dr. Tombris and thank you to all of the VBF staff who texted me the questions, messaged me the questions. I'd like to thank all of you for your patience. Now, we've been doing this for over 3 years, and this is the first time where it was very, very wonky. We've had a little wonky where we've had to wave our hands to make the lights go on or turn the phone a different way to get our expert. But we want to thank Dr. Tombris so much for your time, and we look forward to seeing you in September at our conference in New York. And again, he's always available to answer your questions. The EVA clinic is in Athens. It's a completely comprehensive clinic, treats all kinds of vascular anomalies. He's getting his laser installed very, very soon, so you can check back in with him.
This is a laser we're going to be installing in the operating room setting. We have different lasers at the clinic. These are 2 different places, so that we can do some of the cases under general anesthesia, some other cases under local anesthesia. We can combine treatments with different lasers for the same disease, and it will be a complete we will be able to provide complete treatment options for laser treatment regarding laser.
And Isa, your last question, and again, she's the one that has the purple and blue color changes in the CMTC, and she wants to know, why is it purple, why is it blue? And it's because of the different depths of the different vessels that are involved, correct? It's
most likely that, I mean, again, there is no definite answer for that, but it's a matter of innervation, and it's a matter of, when it gets blue, means that the vessels are dilated. When it fades away, it means that they're constricting.
Nikes is saying, my 11-year-old son's port wine is getting dark with swelling on the side. What can I do to reduce the darkening? But I'd be concerned about that swelling.
Swelling?
My 11-year-old son's port wine is getting dark with swelling, so he's having some maybe tissue overgrowth, right?
Is it soft tissue swelling? Is it
I don't know.
bony swelling?
You're going to have to send Dr.
Bony hypertrophy,
or is it a mixed lesion, maybe with a lymphatic component, and he's sick and the lymphatic? So why don't you email Dr. Tombris at Nike and send some pictures. Also let us know when it started swelling. Was he sick? Did he have a fever? What's going on? The more information you give, and try to get it all into one email with some good pictures, then Dr. Tombris can get back to you promptly, correct?
Yep. These are very, very rare entities anyways. The more information you provide, the better we'll be able to answer to your questions. And this applies to all the experts that are participating in these Facebook Lives. And our intention is to help you, but give us as many ways to be able to help you.
Details, all right.
Details.
Well, thank you all. Signing off from Athens, Greece, live. Technical difficulties and all, but we were there for you, and we came back several times. So, and thank you, Dr. Tombris, and we'll see you all soon.
I was very happy to participate in this Facebook Live.
Thank you. Send your questions, and we'll be happy to respond.